Welcome everyone. Today we'll explore the All-on-X dental implant procedure, a revolutionary solution for tooth loss. In this presentation, I'll provide a step-by-step guide to understanding how this procedure can transform lives. What is All-on-X? The All-on-X procedure replaces a full arch of teeth using strategically placed dental implants. Key benefits: stability. The implants offer a secure foundation, ensuring that your new teeth won't shift or move. Durability. With proper care, these implants can last many years, making them a long-term solution. Aesthetics. They look and feel like natural teeth, helping restore your smile. Improved quality of life. Patients report enhanced ability to eat, speak, and regain self-confidence, significantly improving their daily lives. The All-on-X process. Step 1. Consultation and planning. Initial consultation. We begin with a comprehensive oral examination, a review of your medical history, and a discussion of your treatment goals. Diagnostic imaging. A 3D CT scan helps us assess your bone density, and digital impressions ensure precise planning. Face scans. We always plan our teeth over the computer beforehand to make sure it will look good on your face. Also, it will prepare us during the surgery to take any special precautions we need to take to make sure the teeth will be a perfect fit to your face. Step 2. Surgical implant placement. Anesthesia. Depending on your preference, we will use local anesthetic or sedation to ensure your comfort during the procedure. Implant placement. Implants are strategically placed in your jawbone. In some cases, minimal bone grafting may be necessary. Our plan is executed with a revolutionary Yomi robot so that the implants are placed in the precise planned position. Temporary denture. In about 24 hours, a temporary denture is placed, allowing you to leave with functional and aesthetic teeth. Step 3. Healing and osseointegration. Healing period. This typically takes 3 to 6 months. During this time, the implants fuse with your jawbone, a process known as osseointegration. Step 4. Final restoration. Impression taking. Accurate digital impressions are taken to create your final teeth. Fabrication of final denture. A custom teeth prototype is crafted to fit perfectly over the implants. Placement of the final dentures. Finally, your teeth are securely attached to the implants, giving you a fixed and functional smile. Post-procedure care. Oral hygiene. Regular brushing and flossing are crucial to maintain your oral health. Regular dental checkups. Routine visits for professional cleaning and examination helps monitor your implants. Avoid hard foods. Initially, it's best to avoid hard, crunchy, or sticky foods to allow proper healing. Good oral habits. A balanced diet and avoiding habits such as smoking or excessive alcohol consumption will help maintain your oral health. The All-on-X procedure can be a life-changing solution for individuals with missing teeth. It offers a stable, durable, and aesthetically pleasing outcome that enhances overall quality of life. If you think you might be a candidate for All-on-X, I encourage you to consult with us to discuss your options.